Hey there, my name is Melannie Teitsma. I'm a Manitoba student nurse in Skills 2, Section KO4, here to demonstrate my Foley insertion and removal. So before doing any procedure, I want to check that I have a doctor's order for it. So here I see an order from Dr. Skills Lab to insert a catheter into a Jake nursing, and the reason is to monitor the fluid balance very closely, and it's signed off twice, so we can do this. And I'm just going to note that Jake's birthday is January 1st, 1960. So now that I know that I can do this procedure, I'm going to put aside the doctor's order in case someone might need it later. And I'm going to collect my supplies. So I'm going to take my urinary drainage bag, my Foley insertion kit, the actual Foley itself, a beautiful 14 French with a 10 ml balloon at the bottom, and then also my sterile gloves. And when I'm taking these supplies, I'm making sure that they're very tightly packaged and sterile. Of course, in the demo, most of my packaging is broken, so we're just going to have to work with what we have. But I want to make sure that my supplies are not contaminated. So now that I've collected my supplies and I've already done pericare on my patient, I'm going to wash my hands, take my supplies, I'm going to enter the room and introduce myself. Hi, my name is Melannie Teitsma. I'm your student nurse for today, and I'm here to insert a catheter. So when I'm introducing myself, I'm making sure to do that entrance safety check. So I'm checking that there's no hazards, making sure my patient isn't in any distress, their bed's at an appropriate height, and their call bell is within reach. And so now that I've made sure that that is all good, I'm going to confirm their identity. So I'm going to get them to state their name, and I'm going to check it for their wristband. Can you state your name for me, please? Jake Nursing. And Jake, when were you born? January 1st, 1960. And I also see that the doctor is Dr. Skills Lab, so this is the correct patient I'm supposed to be working with. So now that I know it's the correct patient, I'm going to explain what's going to happen. So what I'm going to do is I'm going to be inserting a catheter into your urethra, which is the top hole of your vagina. And so a catheter is like a long tube that we're using to drain your urine. And the reason we want to do that is we want to really monitor how much you're urinating and compare it with how much you're eating and drinking. So kind of comparing your ins and your outs, and we just want to monitor that very closely until you're in a more stable condition. Does that make sense? And so my patient understands the procedure, and I've given them the opportunity to ask questions, and they're doing all good. And I've already asked them if they needed any analgesic, and so I've already taken care of that previously. So now that they understand that, I'm going to raise the bed up to my hip and waist height, and I am going to assist them into the correct position. So I'm going to get them into a dorsal recumbent position where their knees are flexed out in kind of like a frog-like position, so I have easy access to the genitalia there. And now that they're in that position, I'm going to roll back their blanket so that won't contaminate my sterile field later. And now I'm going to start setting up my own field. So I'm going to start with the urinary drainage bag. I'm going to clip it onto a non-movable part of the bed, and then I'm going to clip this onto the sheets. So generally, I actually like to have the urinary drainage bag clipped on the end of the bed because it helps me later. But for the purposes of the demo, this is all I have. Next, we're going to open up my sterile catheter kit on the side table that's on the left side of the bed. But for the purpose of this demo, I don't actually have a side table, so we're just going to have to work with what we have. So I'm going to open this maintaining sterile technique, so staying within that 1-inch border, making sure not to contaminate, and you can see that. So now that I've done that, I'm going to start setting up my sterile field here. So I'm going to start by passing myself this drape, staying within the 1-inch border. Why does this happen? And so making sure to pass it to myself, 1-inch border, and I'm going to lay it right in between their legs. Making sure to maintain sterility there, and as you can see, my sterile fields are overlapping here, so I'm not going to be using either of this area for sterility, but obviously in reality, I would not have overlapping sterile fields. Next, I'm going to take my fenestrated drape, and so fenêtre in French actually means window, and so in this case, this drape has a window, and we're going to stay within our 1-inch border here, and we're going to drape that window right over top of the genitalia. And so if I need to adjust that, I'm going to do that later once I have my sterile gloves on. Next, I'm going to take my garbage bag, pass it to myself, open it up, and I'm going to drop it on the floor, but actually in reality, I love to put it in between my patient's legs, but for the purpose of this demo, it's going to be on the floor because camera space is very limited. So now that I've done all of that, I'm going to take my catheter and I'm going to open it in a butterfly formation, making sure not to contaminate the sterile blue packaging on the inside, and I'm going to take my sterile blue forceps and remove the packaging and place it inside the boat without contaminating anything, and throw that out. So now that I've done that, I'm going to have to put on my sterile gloves. So for the purpose of this demo, I'm actually going to move my catheter kit up to here, so I'm staying within the 1-inch border. And I'm going to take my sterile gloves and I'm going to put them on over here, but in practice I always like to do it at the end of the bed. So now I'm just going to open this while staying within that 1-inch border. I'm going to pick up the left glove on the inside of the cuff, and I'm going to slide my hand right into there, making sure not to touch the outside with my dirty hands, but only touching the inside. Sometimes this goes really, really well, and sometimes it does not. So that went on without contaminating, and I can readjust later. Next, I'm going to, can you see this? Yep. Slip my fingers under the cuff, and making sure to keep my sterile thumb far away, I'm going to slide my hand into there. And I am going to, when I'm twisting my hand around a bit, I am making sure to only touch the outside. And so that was disastrous. I've had many better tries. So I'm going to adjust my sterile gloves. Watch, this is the one that actually works. I'm going to adjust my sterile gloves while only touching the outside of the gloves and never touching my arms. So now I have successfully done that, and this has turned out way better than I thought it would, considering how it started. So now I'm going to take this and I'm going to throw it out, and so the inside of that is sterile. So that was not a contamination. And now I'm going to take my sterile gloves, which I have adjusted, and I'm going to start, and I have not touched my arms yet, so that's a blessing. I'm going to start organizing my boat here. If you can't see everything, I apologize. I will do the best I can to narrate. I'm going to open up this catheter package, and I'm going to inspect the tip, and I see that the tip is intact and it's looking really good, really good. Next, I'm going to take this sterile water syringe, which has 10 cc's of sterile water, and I'm going to want to connect that to my balloon port here. As you can see, just connecting that in. Next, I'm going to want to take my catheter tip and I'm going to want to lubricate it. So for women, I like to go about 5 inches or a little bit more, because I find you more the better within reason, lest you end up causing some trauma. So for the purpose of this demo, I'm not actually lubricating since I don't want to run out. And so now I have lubricated the 5 inches or more as best I can. I'm going to throw that out. And then lastly, I'm going to take my swab stick package. And something I learned in lab is that we can actually take the swab sticks completely out and just place them in our tray and then throw that out right away. I find that gives me a lot less stress later. So now that I have completely set up that field here, I'm going to move it right between my patient's legs. And I'm going to adjust sterile field as needed, since my gloves are sterile and the drapes are sterile. This is a thing I'm allowed to do. So now that I've done that, I'm actually going to take my non-dominant left hand and I'm going to place it on the labia to expose the urethra meatus, and I'm going to start cleaning with the swab stick. So I'm going to start on the far side, top to bottom. Then I'm going to go to the near side, urethra, to anus, and then finally to the center, clean to dirty. And now that I've done that, I'm not going to remove my hand from this location, and I'm going to take my lubricated catheter and I'm going to instruct my patient to bear down and take some deep breaths, and I'm going to slowly insert the catheter. So I'm meeting some resistance, but I'm just going to push past it. My patient is doing well. Just going to keep sliding it in there, making sure to not move my left hand from here. And so with women, we like to go about 2 to 3 inches and until we see urine flowing. And now I see urine flowing into the boat, so I'm going to go another 1 to 2 inches because we want to make sure that we are actually in the bladder. So now that we've done that, and I see that there's urine flowing out into the boat, I'm going to take my left hand, I'm going to take my thumb and index finger and I'm going to stabilize, and then I'm going to take my right hand and I'm going to insert sterile water, so these 10 milliliters of sterile water, and I'm going to do that while maintaining palm pressure and trying not to let urine spray everywhere. So inserting that, and now disconnecting. And so now that I've done that, I'm going to give it a bit of an experimental tug, and it is doing really well in there. So now, as you can imagine, there's a lot of urine flowing out into here. So I'm going to take my urinary drainage bag, and I'm going to take off the cap while not contaminating the hub, because as you can imagine, both of my hands are now non-sterile. Next, I'm going to take the catheter itself, and not contaminating the hubs, I'm going to connect these two together. And so now they are connected. So now I'm going to do pericare as needed, and I'm going to connect the catheter to my patient's leg with tape and clip this back onto the sheets if needed. And so now that I've done all of that pericare and my patient looks comfortable, I'm just going to talk to them a little bit and ask them how they tolerated the procedure and how they're doing. And so they feel really good and they feel like the procedure went well. And so now that I've done that and I see that there's urine flowing into the drainage bag, I'm just going to remind the patient that I'm going to be looking for at least 30 milliliters of urine per hour, and I'll be back to check in and monitor your ins and outs. And so my patient is doing really well. And so I'm going to now remove my gloves and wash my hands as needed, and then going to exit the room. And I'm going to document the procedure. We're at 12 minutes. So the procedure went really well. The reason that I inserted the catheter was because we were trying to monitor the fluid balance very, very closely. So I did insert it according to the doctor's order. And I inserted it at, I'm going to say it's about 10:30 at night right now. And my patient tolerated the procedure well. I would include all the analgesics that I had to use for the procedure. Generally, we use a local numbing agent at least, and then I would also include any other things we had. I would include the type of catheter that I inserted. So in this case, I inserted a 14 French with a beautiful 10 ml balloon at the end. And I'm going to include that I inserted 10 cc's of sterile water into there. And then any other relevant information, such as the fact that the catheter was intact and there was no breach of sterility, and then any basic comments that the patient had. But other than that, those are the specific things that I would have, plus also including that I want to be seeing at least 30 milliliters of urine per hour. So now that we've done that, breaking news, I've actually received news that I'm supposed to remove the catheter now. And so I'm going to look at my doctor's order, and I see that there's an order from Dr. Skill's lab for Jake Nursing to remove a Foley catheter, just because we no longer need to monitor the fluid balance as closely. So I am going to start collecting my supplies. So what I need for this procedure, I do not have gloves on right now. When I was cleaning up my bedside, I removed my gloves and washed my hands. But for the purpose of this demo, I'm keeping them on. So I'm going to grab a pair of clean gloves, and I'm going to grab my 10 ml syringe, which would not be on the floor. And in my scenario, I also put the blue absorbent pad already underneath the bottom of my patient as part of their bedding as foresight, so that's not something I'll need to worry about. And so now that I've collected all of my supplies, I'm going to wash my hands, and I'm going to enter the room and introduce myself. Hi, my name is Melannie Teitsma. I'm your student nurse for today, and I'm actually here to remove a catheter. And so when I'm introducing myself, I'm making sure to check that there's any hazards, making sure my patient looks comfortable, their call bell is within reach, and their bed's at an appropriate height. So now that I have checked that, I'm going to double check their identity. So can you state your name for me, please? And I'm checking that with their wristband. Your name is Jake Nursing, and when were you born, Jake? January 1st, 1960, and the doctor is Dr. Skill's lab, so we know this is the correct patient. So now that I'm here, I am going to be explaining the procedure to the patient. So what's going to happen is I am removing your catheter. So it's pretty much the opposite of inserting a catheter, where I'm just going to remove all the water I inserted into that balloon, and then I'm just going to slowly pull it out. And so we're doing that just because we don't need to monitor your fluid balance as closely. Does that make sense? And so my patient verbalizes understanding of the procedure and is ready to go, doesn't need any analgesic. So we're just going to get right into it. I'm going to do pericare as needed beforehand, and of course make sure I'm wearing clean gloves for that. And then from there, I'm going to make sure I have clean gloves on and I've already done hand hygiene. And I'm going to look at the urinary drainage bag. And I see that there is 800 milliliters of clear amber urine in here. And so I would drain that and I would record that immediately in the ins and outs record for this patient. And I would include any other relevant information such as odor and sediment if that was applicable to this situation. And so now that I have documented that, I am going to assist my patient into the correct position. So in this case, it's just supine with their legs slightly spread, of course, so I can actually access the area. And I'm going to remove the tape from my patient's leg. And now that I've done that, I'm going to get on with the procedure. So I'm going to attach my 10cc syringe to the balloon port here. And I'm just going to try and remove that 10 ml of water. Just kind of letting it flow into there and stabilizing as needed. So I'd like to do a 2-pass effect because I want to make sure that I actually removed all of the water. And so I have now removed all of the water. And so now that that's all going well, I'm going to stabilize the catheter here, and I'm just going to start removing it by bunching it up in my hands. And now that I've removed it, I'm going to inspect the tip, and I see that it is intact and it's looking really, really good. And so now that I've done that, I'm going to take my urinary drainage bag and my catheter, and I'm going to bundle it up in my absorbent pad, and in that way just clean up my area. So now I've cleaned up my area. And then from there, I would do pericare as needed. And then I'm just going to talk to my patient a bit, and we're at 17 minutes. I'm just going to ask them how they tolerate the procedure, and I'm just going to remind them that they're allowed to urinate on their own now, so they have the supplies for that. And we're looking for urine in at least the next 8 hours. So now that I've made that clear, I'm going to put their bed back at the original position that it was in, and making sure that their cowbell's within reach, that they're feeling comfortable, and there's no hazards. And also that their blanket is rolled up and they have maximum modesty, which is always something we want to do after a procedure. And so now that I have made sure that that is all okay, I'm going to leave the room and I'm going to document the procedure. So we've already documented the 800 milliliters of clear amber urine in the ins and outs record and with any other relevant information as needed. And so now we're just going to document from there. Just to clarify, before I leave the room, I would always remove my gloves and wash my hands. But for the purpose of the demo, I am keeping these on because I want to repackage them up in a very specific way. So I'm going to document the procedure, which includes why I removed the catheter. So we no longer needed to monitor the ins and outs as closely. So my patient is allowed to have it removed. And I removed it at about 11 p.m. at night. And then I would also include how the patient tolerated the procedure. So my patient tolerated it really well, did not require any analgesic. I would also include the type of catheter I removed, which I would find from the insertion record. I removed a 14 French catheter, and then the fact that I also removed 10 milliliters of sterile water would be really important, and that the catheter tip was intact. And so now that I have made sure that all of that is a-okay and I've documented anything, I would also put in any other relevant information I found within the procedure as needed. But now everything is documented and my patient is comfortable and the procedure is done. So now I think I'm going to end my demo, and I wish you guys a great night. Bye.